Well, it's time now for our In Focus Health update, and we're joined by reporter Linord Moudou, who has the latest news about the battle against malaria. Hi,
Hello,
Linord. Thanks for coming again. So tell us about this battle.
Well, African leaders have launched an innovative tool which they say they expect will help them better monitor their efforts to fight malaria. Every year, 250 million people are infected with malaria. The World Health Organization says every 30 seconds, a child dies of malaria in Africa, and the disease accounts for approximately 20% of all childhood deaths. The fight against malaria has intensified in some African countries. Rwanda has reduced its malaria death rate by 60%. Dr. Agnes Binagwayo is Rwanda's Minister of Health.
What we have done to reach those progress in Rwanda, we have intensively distributed insecticide-treated nets, artemisinin, but more than that, we have focused our activities where the people were dying and where the people were sick at community level. We have a national policy for community health, where the first pillar is community participation. But our objective as government is to keep 80% of any burden at community level where the people are living.
Rwanda's success is not the only one. In 2009, at least 10 countries on the continent have reduced the burden of malaria by 50% since the turn of the century. President Jakaya Kikwete of Tanzania.
The dividends are becoming obvious. It is a statement of fact that malaria infection in Africa is receding.
Statistics on the fight against malaria are being tracked by a new tool designed by the African Leaders Malaria Alliance, ALMA. It's a malaria scorecard. Dr. Joy Fumathi is Secretary General of the group.
This scorecard has identified actionable indicators for policy that is related to achieving results in the fight against malaria, financial control and management in country of all resources, whether they be domestic resources or international donor resources that are used in country in the fight against malaria, and of course in the health sector.
The ALMA scorecard alerts leaders to the progress or gaps in their country's efforts against malaria. The ALMA scorecard was launched recently in New York by President Jakaya Kikwete of Tanzania, the acting chair of ALMA. Experts say the success in the fight against malaria is due to a combined approach: the use of insecticide-treated bed nets, indoor residual spraying, artemisinin-based combination therapy, and accurate and rapid diagnosis. Africa aims to reduce malaria death to near zero by 2015, one of the United Nations Millennium Development Goals. Again, President Kikwete.
Despite the impressive progress made so far, a lot more needs to be done. The first one is sustaining the gains. The second challenge we see is lack of compliance on the part of both member countries, the African countries, and donor partners, with the Paris Principles and the Abuja Declaration Plan of Action. Third, protecting existing financial and technical resources and identifying new sources of revenues.
As it is said that ambitious goals need ambitious tools, the authors of the scorecard hope that the new tool will prompt leaders, decision makers, as well as partners to address obstacles, implement new needed policies, and ultimately save lives. ALMA's malaria scorecard is available online on the ALMA website at www.alma2015.org and updated every month. And during his recent visit to the United States, I spoke with Tanzania President Jakaya Kikwete and asked him about the impact of malaria on the continent.
Its effects: children don't go to school, their fathers and mothers don't go to work, the loss in GDP, the loss in income, the estimate is about $12 billion per annum. So it's such a significant thing.
Why was it important to start ALMA?
As individual countries, we've been taking action. But what some of us realize is that we need coordinated efforts. We need to cooperate among countries in order to increase the strength to fight the disease. Mosquitoes travel. If somebody boards a bus in Dar es Salaam, goes to Kigali, you may just carry mosquitoes with you. If Kigali doesn't have malaria, they can get malaria. And this is precisely what happened in many parts of our country. So this is a factor that working together was also necessary. But collectively, joint purchases of bed nets, of medicines, and so on, also is cost effective. So this is what actually has driven us to conceive the idea of forming African Leaders Malaria Alliance.
Today you have launched the scorecard,
yes,
which is a way really to monitor how countries are doing, in terms of progress. What do you think that we'll be able to achieve?
We have given ourselves indicators: availability of insecticide, long-lasting bed nets. That's one aspect. The use of artemisinin in combination therapies. With the bed nets, we had agreed amongst ourselves that we must remove tariffs, import duties for bed nets, so that bed nets can be cheaper. So we are looking at a number of these interventions. So we are being told on this one, no, you are still in the red, that you are not doing well. On this one, you are on green, which means that we have met the targets. On this one, you are on yellow. You are making progress, but not yet on target. It is useful for the country to know exactly what more needs to be done. For our development partners who are assisting us in this fight, so it works both well for us. The areas that we are making progress, the areas that more intervention or more work needs to be done.
Thank you so much, Mr. President.
Thank you.
And that's President Jakaya Kikwete of Tanzania.
This is a nice interview. Well, thank you so much for bringing all that to us, Linord Moudou.
Sure.
And that's Linord Moudou, our health reporter, joins us every Thursdays and Tuesdays right here on In Focus.